Treatment of acromegaly has substantial effects on body composition, a long-term follow-up study by Wolf et al. Acromegaly is a clinical syndrome caused by increased serum concentrations of GH and IGF-1. GH has anabolic actions on muscle and bone, and catabolic actions on adipose tissue as it stimulates lipolysis. The aims of this study were to evaluate body composition parameters in a large cohort of patients with acromegaly and to assess longitudinal changes in these parameters in a subgroup of patients before and after disease control. This was a retrospective study where 201 acromegalic patients met the criteria for cross-sectional analysis of characteristics. Longitudinal analysis was conducted in a subgroup of these patients. 31 patients were in active disease and then controlled disease, A to C, and 32 control patients were in controlled disease at both DEXA measurements, C to C. In the whole cohort, fat mass and lean mass was significantly predicted only by IGF-1 levels and sex, although they did have correlations with other factors. IGF-1 levels had a negative correlation with fat mass, but a positive correlation with lean mass. Female sex was positively associated with fat mass, but negatively with lean mass. As shown, decreased IGF-1 levels were associated with increased fat mass and decreased lean mass in the A to C group. These changes were 4 and 8 times more pronounced, respectively, compared to the C to C group. So, why is this important for patient care? Well, the loss of lean mass and gain in fat mass has an impact on quality of life. Patients should be informed of this effect before commencing treatment. But once the disease is controlled, any changes overlap those observed with aging in the general population. To read more, please scan the QR code or use the link provided on the slide.